Well, I think it starts with your perception of what your role is as a doctor. So I've tended to think of myself as a guide to the patient. So they, the commonly used term is they are on a cancer journey, and they have choices to make. And my role is to provide guidance as to what the choices are. If I'm comfortable with one choice, saying this is my best choice of what you should do, but to offer other options and to help the patient decide what they think is the best choice for them. Now, you can't do that if the patient doesn't understand what their values are. So that requires some exploration. Is it longevity? Is it living longer at any cost? And that might be so. Maybe someone has a child's wedding coming up, and they say, I got to make it to this wedding. So it could be longevity at all cost. It could be financial costs. It could be I don't want to go bankrupt and bankrupt my family. It could be I don't want to have bad symptoms. I don't want to end up on a feeding tube. I don't want to be in the ICU. I don't want to risk being hospitalized. So those are things that need to be explored for the patient to identify what their values and preferences are. And unless you do that, you cannot have the discussion that needs to happen.